Assalamu alaikum and welcome back to the Medic Hour. We've been talking to Dr. Liz about minor ailments. We've been listening to her give us advice about coughs, colds, sore throats and a variety of other things including earache. So hopefully you're joining us to follow on with what we've been covering earlier. So what I wanted to do, Liz, was ask you about a condition that's called conjunctivitis, which comes under this category, but what is it?
Right. Very often when people get coughs and colds, sore throats, particularly young children, we may find as well they've got sticky eyes. So the technical term for sticky eyes is conjunctivitis. Anything that's got an itis at the end means an infection in. So for instance, tonsillitis, appendicitis. So conjunctivitis is an infection there. And the conjunctiva is the covering over our eye. It's a bit like cling film. So I look at your eyes and they're bright and shiny, and that is the cling film, that's the conjunctiva. And if that becomes infected, which it regularly can do with the same germs causing the coughs and the colds, then you can have really sticky eyes. Sometimes people will have sticky eyes without all the other problems as well. And sometimes it can be a sign of an allergy. But at this time of year, we're often finding people are getting conjunctivitis from the same sort of bugs. So, and it can be really awful, particularly when you wake up first thing in the morning, your eyes are stuck together, and kids can be really awful. So the important thing to do is we need to bathe the eyes. And the best thing is cotton wool, which we've doused in cold boiled water. So we've boiled some water to get rid of any germs, and we then use that to bathe the eyes. And you may need to do that quite regularly.
I remember this from when my children were babies. I mean, my children are adults now, but when they were babies, I remembered on the maternity ward, they used to teach you to use a cotton wool ball, dip it in the sterile water, squeeze it out, and then wipe from inside to out, throw it away, and then do the other eye. So you don't use the... Is that right?
And obviously with really clean hands. And it's one eye at a time, because you sometimes, not very often, if you're not careful, you're passing infection from one eye to the other eye, and you could pass it from the child to you if you don't wash your hands. This is why schools can be sometimes very strict. If a child has conjunctivitis, they won't want the child in the class because they're fearful it will be passed on. So being very, very careful about doing that.
So one cotton ball for one eye,
before,
and then separate one for the other one. That's really helpful.
You know, Rabina, you've just reminded me of something. Do you remember you said about putting your hands over your mouth if you cough and cold? I really think it's worth talking about that, because the reason I can pass my cold on to you is because when I cough and sneeze, the droplets that come out when you cough, when you have a cough, they're stuffed full of the germs. So in theory, if I cough all over you, those germs are going to be passed on to you. So when I cough, I should protect you by putting my hands in front of my mouth. However, that means all those germs, all those droplets are all over my hands.
You didn't have a tissue, did you?
Exactly. So having a tissue is the best thing, because then you can catch them in the tissue and we can then throw the tissue away. However, you can't always get to it. I've got a tissue under here, but you can't always get to it fast enough. If you cough onto your hands, just think with my dirty hands, I then touch this glass, I then touch there. I'm at work, I do it on the computer. I'm at home, I touch the kettle. I'm going to be passing my germs on to everybody in the family or where I work. So if you have a cough or a cold, you are duty bound to be really careful with washing your hands. I mean, none of us would dream of going to the toilet without washing our hands afterwards. We must think the same thing if we've got a cough or a cold.
I have a habit in my house, my guests, particularly the very young guests that come to my house, including my grandchildren, if they dare put their finger up their nose without a tissue, they not only have to go upstairs and wash their hands, but they have to put some money in the charity box. So I think we all need some rules like that. And we'll be supporting charities at the same time.
I will not be arguing with you.
I'm quite strict about those rules, but it's one of the things that really concerns me as a mum and a grandma now, where I'm constantly thinking, you know, we live in, even when you go into town, people are coughing and spluttering, and there's nobody, well, even any time of year, people don't have the habit of covering their mouths and their noses when they're coughing and sneezing.
Sometimes it can happen so quickly, you just can't get there in time.
Yeah,
but
that's,
no, I
appreciate that, yeah.
But no, we should, particularly at the moment when there's so many coughs and colds around. So just something as simple as that can prevent us passing it on. Because one of the first questions I'm saying to my patients when they're coming in with their coughs and the colds is, anybody else in the family? And almost always you'll hear, yes, my brother's got it, my son's got it, or half the class are off school at the moment. So absolutely crucially important.
Yeah, this hygiene thing, we sort of underestimate how important it is for lots of reasons, don't we? So it's really useful that you've reinforced my point.
Well, there you go.
Thank you very much for that.
Don't you go telling your grandparents that I'm in.
Now I'm going to say Dr. Liz said I'm right on this.
Yeah, right, yeah, got it.
Anything more on conjunctivitis we need to know?
No, I think that's it. Well, the only thing I would say is sometimes conjunctivitis does need to be treated with antibiotic eye drops.
Okay.
So if you've spent some time bathing the eyes, trying to give it time to sort itself out, but it's not getting better, then again that's something to go back to the doctors.
And we're not talking about salty water, we're talking about plain water, aren't we?
Well, yeah, I think so, yes. And in fact, it'd be quite uncomfortable if you put salt in the water.
I just have this memory, and maybe I'm wrong, but I just remember there was a time when we used to put salt in the water.
Oh, we used to, and people still talk about putting salt. So I'm not going to knock that, because some people still do. And whereas I don't think you'll come to any harm unless it's very salty and it could be uncomfortable in the eye.
It needs to be dissolved, doesn't it?
Yeah, I mean, some people say salty things, nasal washes, if you've got nasal problems. So I'm not going to knock it. I'm just going to say, when I'm thinking about conjunctivitis, my priority is the cold, boiled water.
Yeah. Okay.
So, right, I think probably conjunctivitis we've probably finished with now.
Thank you very much for that. We're going on to the very lovely topic of diarrhea and vomiting.
Right, yes. Who would...
D&V.
What hour on the television would be complete without a chat about diarrhea and vomiting? Right. Well, again, we're talking about... At this time of year, we're talking about germs causing coughs and colds. Yeah. It doesn't have to be the winter, does it?
No.
For coughs, for diarrhea and vomiting at all. But it seems to fit in at the right time. So very often, the reason people have diarrhea and vomiting is because they have usually eaten something which has got those germs in it. Can be drinking something, but very often it's eating something. Maybe something's been in the fridge a little longer than it should have been, it wasn't fresh. Who knows? This
makes me also think about, and I know it's not the best topic, and over tea time it's obviously not the best topic, but it's important, is about hygiene after using the bathroom, the toilet.
Well, as I said only two minutes ago, absolutely crucial. We should all, every time we go to the toilet, be it to pass water or do a poo, we should wash our hands. And we should be, again, talking to our kids from an early age that it's done without even thinking about it.
Yeah, and it's also training them about to do it correctly, because a lot of the time when I've seen my grandson using the bathroom, it's about encouraging them to use warmer water. It's supervised, of course, making sure it's not too hot, but the soap and the water together, because a lot of the time it's a quick rinse under a cold tap and that's the end of it. And I'm wondering whether that's good enough.
Well, gosh, I'm sure people have spent years and years doing research on this, and I'm sure there'll be some very clever person who can tell us the right temperature, the right soap. My attitude is something is better than nothing.
Sure.
And I don't think you have to spend 10 minutes over it. If we were about to do a surgical operation, then we've all had training. When I worked in the hospitals, it was a very definite way of the best way to wash your hands.
Well, we're still training medical students on this today.
But at the end of the day, when you go to the loo, everybody, if soap's there, we should be using, and I don't think it really matters if the water's warm or cold, to be honest. I think the water, the soap, rinse it off properly and dry your hands.
Okay.
And so I'd just be grateful that your grandson's having a go, really.
Yes, he's been well trained.
I would pat him on the back and pat him on the back for that.
I'll remind him.
We're getting our diarrhea and vomiting most of the time because we have eaten something which is upsetting our tummies. And so very often the diarrhea and the vomiting will be part of the same problem.
Okay.
Sometimes diarrhea comes without vomiting, but sometimes you will have the combination quite often.
And that's just because the bugs are in the body.
Exactly.
And via the stomach.
Yeah, and they're either going
down,
out at the top end or out at the bottom end.
Okay.
So what's the best thing to do if somebody has diarrhea and vomiting? Well, first of all, we don't want you to eat anything.
Right.
If you've got germs inside your tummy somewhere and you're eating, I sort of think of it as we're feeding the germs.
Okay.
So what we want to do is to starve the germs out of our system.
Okay.
But what we do need to do, and this is absolutely essential, is to drink plenty.
So back to the fluids then.
Back to the fluids, but not thinking of drinking the milk, the fruit juices, all those things which have got sugar or energy in them, which is going to feed the germ.
Right.
The best thing to go for is water. Cheers.
Sometimes when I'm feeling a bit under the weather, I'm not saying necessarily because of those symptoms, but I know sometimes having a warm drink of water with honey in it or lemon in it is nice and refreshing as well.
Yeah, but the honey, what's honey, Rabina?
It's a food.
It's a food.
Yeah.
I'm not saying we shouldn't be doing, and I think sometimes if you get so hungry, because some of, don't know about you have diarrhea for a couple of days, so I'm not going to knock that, but the best thing to do is to starve the germ out of your system. Okay. So lots of drinks, because look at it this way as well. If you're being sick, if you've got diarrhea, you are losing fluid upwards and downwards. Yeah. So what we don't want is anybody to become dehydrated. So drinking plenty is absolutely essential. Becoming dehydrated, you can feel really, really unwell.
What's the word for what's the layman's term for dehydrated for those of our, community that don't know English as a first language?
Yeah, dry. Okay. I think dehydration is quite a common word.
I'm just thinking about community that don't have English as a first language.
Yeah, no, I think becoming dry, because if you are not taking any fluid in, because you're not eating or drinking, and then you are losing extra fluid, it makes sense that you will become dry. Yeah. So plenty of fluid, and the best fluids are clear fluids. Yeah. So have tea, have coffee, but preferably without any milk, because milk's a food, isn't it?
Yeah.
So
it's going to aggravate the stomach.
Yeah. Okay. And most diarrhea and vomiting will get better within 2 or 3 days.
And imagine you're flushing out the germs as well.
Exactly. Okay. So now you can get tummy ache with this. So you may need to consider, here we go again, back to something like paracetamol.
Right.
Now I'm going to emphasise paracetamol with the diarrhea and vomiting because ibuprofen is a medicine that should be taken ideally after food, because it can cause an upset in your tummy.
Right.
So if you've nothing in your tummy because you have been purposefully not eating anything and you take ibuprofen, in theory you could upset your tummy. Okay. So I'm going to emphasise paracetamol for if you've got diarrhea, sickness and you're feeling sickly. Now, let's be honest as well, you might take that paracetamol, but if you're being very sick, it might not have chance to be absorbed. You may end up bringing it back. Yeah. But you may just take it within enough time to get some of the benefits from it, even if you don't. And again, diarrhea and sickness that is not getting better, or if you're very poorly with it, I mean, some people can get a mild temperature, but if you get a really high temperature and diarrhea and sickness, then the question is, what's going on? Is it just something I've eaten? The other thing is, very often diarrhea and vomiting can be within a family, so there may be 1 or 2 members of the family. Yes. So that's reassuring that it's something you've eaten, it's nothing else that could be more serious going on.
Do we need to talk about the something else that could be going on?
I think at the moment, let's just concentrate on the diarrhea and vomiting. Okay. Otherwise, we could talk about 27 other things. And
we can come back to that maybe if there's questions about it. Yeah. Okay. So that's been really helpful actually, because it's very much around the reinforcing the message about fluids and keeping yourself hydrated and looking after yourself at home. When do you need to see the doctor?
I think if you've got a very high temperature with it, if after several days of being very sensible, not eating too much, drinking plenty, things are not getting any better, particularly with young children. I think then you do need to see the doctor.
Okay, all right, thank you for that. Let's talk about headaches.
Headaches. Big subject, headache. So again, we're going to very much focus in on the headaches to do with, which are non-serious headaches. Huge numbers of people in the population have headaches.
Yeah.
Huge numbers. I bet there's not one person watching us today, Rabina, who hasn't had a headache at some point in their lives. And some people are more unfortunate than others and are more prone to headaches. So I'm going to start off perhaps by talking about one of the commonest forms of headache, which is a tension headache. But I do want to talk very much later about serious headaches, which would definitely need to be seen by a doctor.
Okay, that'd be really helpful,
So
thank you.
we'll talk about the tension headaches. And headaches, we talked about the coughs and the colds and these virusy bugs, will very often have headaches with them.
Yes.
And there might be a bit of dehydration in there as well. So headaches often part of the coughs and the colds. I know I've had a bit of a headache with my virusy bug. So again, the paracetamols for that. But tension headaches, one of the commonest, probably the most common form of headache. And why is it called a tension headache? Well, probably because a lot of these headaches can be felt anywhere round the head,
Right.
or in the back of the head.
Okay.
And it's very often to do with at the back of our neck, the back of our head going into our neck, we have really quite strong muscles. And if those muscles are pulling,
Yes.
they will pull on our head, and that can give us a headache. And that's tension coming from the back of our heads.
That's why a massage can feel lovely.
Absolutely. And most of us, our posture's not very good. Our shoulders are a bit tense.
sitting
Here we
again,
are.
hadn't
So
I?
yeah, so you see all these muscles here are quite tight and they're pulling. And of course, if you are worried or stressed, if your posture's not very good, if you're in a desk job and you're not sitting properly, that's going to add up. So it doesn't take too much to push that then into showing as a headache.
Okay.
Dehydration's another thing to think of with the tension headaches. But stress, working hard, those sorts of things are often, people can often say, oh, I've had a real rotten day at work, got a real headache. And so how much of that was them concentrating hard? You can almost see all my forehead becoming all furrowed up.
So we're tightening those muscles
Tightening the
out,
muscles, taking time to just bring your shoulders down. And here we go again, something like paracetamol, ibuprofen, really helpful.
How helpful would deep breathing exercise be for things like that?
Can be very helpful.
Okay.
Something like in the middle of the day, this really stressful day, finding, even if it's only 5 minutes, to go outside the building, walk round the building, take some fresh air in, can be so much better. I mean, things like we talked about physical activity, didn't we? On an evening, if you can go for a walk before you have your tea or after your tea, if it's a summer evening, can do so much for, like, you're talking about boosting resistance, making us feel better, and it doesn't cost us anything either.
No.
So tension headaches, very, very common problem. What sort of headaches are so serious we should think they need to be seen by doctors immediately?
Yeah.
For instance, a very severe headache which comes on really very suddenly, almost like somebody's bashed you on the back of the head.
Oh, okay.
So something very sudden and severe like that should be seen immediately by a doctor.
Okay.
If you are very, very unwell with a really cracking headache, high temperature, stiff neck with a headache, I think everybody, all mums, when I see them bringing their children in who are poorly, one of the things they're all very frightened about, what am I thinking of?
Meningitis.
Meningitis. Do you know what meningitis means?
I don't actually.
The brain is covered in a bit like cling film again.
There's a lot of cling film about.
There's a lot of cling film about. So not just our eyes, but our brains. Our brains are covered in cling film. And that layer of cling film actually extends down the back of our necks, down our spinal cords, goes to a certain level. And that's called the meninges. And do you remember we said anything ending in itis is an infection?
Yes.
So meningitis is an infection of the meninges and can be very, very serious. So bad headache, high temperature, neck stiffness, that is a definite reason to go and see the doctor very promptly.
Now, when you're talking about very promptly, are we talking about waiting to get an appointment at the doctor? Or are we talking about that's the time to go to A&E?
For a child who is so ill, during daylight, when the doctor's is open, it's ringing the doctor and explaining what the problem is. Now, all surgeries are different. You and I have no idea how all surgeries man their phones, decide who has appointments. But I would certainly say the first port of call is an immediate phone call to your GP surgery if it's open and explaining what the problem is.
Sometimes we've got these drop-in centres when they're closed as well.
Drop-in centres.
Yeah.
If it's out of hours, we've got the telephone service, the 111.
Right.
So, and if you ring that and explain what the symptoms are, then you will be advised appropriately, either the doctor coming to see you or advising you to go to A&E.
Yeah.
So that I would class is a medical emergency and should be seen. But do you remember, that's really a very, very poorly person.
Yes.
So that's something that I think does need to be seen. That is not something you wait till the next day.
Okay. We hear about migraines or migraines. How do we pronounce that?
Could I just interrupt you once more? Yeah. Another time when I think headaches are so serious, they should be seen immediately. If a headache comes along, usually very, very quickly, and is associated with losing the power or the feeling in an arm or a leg,
right,
something like that, I would class that as a medical emergency.
Yeah.
I'm thinking of strokes and those sorts of problems.
Yeah.
So I'd just like to emphasise that as well.
No, that's really important that we get that in, yes, absolutely.
Bad headache involving loss of vision, again, that's something I think should be seen.
So these are not things that have necessarily crept on gradually, these are things that can happen suddenly.
Yes.
So those are the most...
Yeah, they tend to be, when I say sudden, they doesn't have to be in 0.3 of a microsecond. No. It can be over half an hour or so,
right.
But I'm not talking about something that's necessarily been going on for many, many days. Right. But again, Rabina, everybody's different. Yeah. It's so difficult for me to sit here and generalise about problems.
No, I can appreciate that, but I think what's always reassuring is knowing that if you're not sure, ring 111 or the surgery, wherever you can get to whatever time of day it is, and ask for advice before you start ringing the ambulance at least.
Absolutely.
And if you're so convinced that it's an emergency, then you would call the ambulance, wouldn't you? Yeah. Okay. Shall we come back to migraines?
Yeah, okay, migraines.
Do we say migraines or migraines?
I think...
Doesn't it matter?
You say migraine, I say migraine, you say tomato, I say tomato.
Fair enough, okay.
I really don't think it matters. We understand exactly what we're talking about.
Brilliant.
Migraines are a form of headache. And migraines are, again, different for different people. And what a lot of people who have migraines find is that before the cracking headache comes, they have a warning it's going to happen. And very often for those people, there may be a visual disturbance. Now, again, the visual disturbance can differ. It can be anything from flashing lights to a bright light. Some migraine headaches may come without any lights. There's treatment, again, paracetamol and ibuprofen for migraines. Some people can take special tablets and those can help to prevent the migraines, or special ones for when they've got a migraine.
Thank you so much for that. I can't believe how quickly the time's gone by, and we've only just started to touch the tip of the iceberg, really. But I'm very conscious of the fact that we need to do some recaps as well as some top tips for today. And if there's enough time before we have to wind up, just a reminder of when you should go to emergency and when you shouldn't. So if I asked you what the key points you'd like to make for today's programme would be?
Well, the trouble is we need to go into each category, don't we?
So if we looked at coughs, colds and sore throats, what's your top tip for that?
I would say plenty of fluid, paracetamol, ibuprofen. Don't expect to be better overnight.
Earache?
Earache, plenty of drinks, paracetamol or ibuprofen, depending or whichever people's preference are. And again, give it time. Not getting better after a reasonable time, a day or so, go to the doctor.
Conjunctivitis?
Bathe it with cold boiled water. Should get better on its own within a day or so. If not, you may need to go and see the doctor. Your vision should not be affected with conjunctivitis if you get rid of all the gunge that's there, but your vision per se shouldn't be affected. So if your vision's affected and it's not because there's any of the gunge in the way,
sure,
then that is something other than conjunctivitis,
right,
and should be checked on.
Okay, that's a good tip. Diarrhea and vomiting?
Diarrhea and vomiting, most important thing is fluids. Gosh, fluid is the
Yes,
common factor,
common
isn't
thread,
it?
yeah.
Make sure we're drinking plenty. Drink plenty, try and starve. If you're absolutely desperate, then something like a slice of bread or some boiled rice, something very simple, just so you feel that you've had something.
Yeah.
But try and starve the germ out of your system.
That's really helpful. And headaches?
Headaches, attention-style headache, which is not associated with losing the function of an arm or a leg, with losing sight, that does not come on really suddenly, the sort of tension-style headaches. Again, think about the paracetamols, the ibuprofens, plenty of fluids.
That's been so helpful, Liz. Thank you so much for that. And so we come to the end of the show again. It goes by so quickly, and I hope you found it useful. Our next topic will hopefully be about heart health, so get your questions ready if you've got things you want us to cover on that. And in the meantime, I look forward to seeing you all again. Assalamu alaikum wa rahmatullahi wa barakatuhu.